Thank you very much. And good afternoon. Thank you for being with us here today. Again, I'm Kelly Clark, and I am a psychiatrist as well as an addictionist. And so I want to talk a little bit to kick things off from the addiction side. And so before we start a conversation, because we're going to have time for Q&A later, I just want to make sure we're all using the same language. So just very, very briefly, addiction is a chronic brain disease. Okay? Substance misuse is not. Substance dependence is not. So let me give you some quick examples, okay? So anybody to have coffee this morning to wake up, substance use, okay? Substance use, not a disorder, okay? People who are taking medicines or any substances not as exactly prescribed by their physician, that's misuse. So for example, if you took your spouse's sleeping pill last night, that's misuse, and it's also illegal diversion of a controlled substance. True. So, okay, dependence is what happens if I give you, so if I gave all of you an opiate 3 times a day for, I don't know, a week, and then gave you 2 of them 3 times a day for a month, and then stopped, you would be sick. Okay, you would be sick, and that's because your body had become physically tolerant and you were going through withdrawal, okay? That is not addiction. That's just physical dependence, okay? Addiction is a chronic brain disease, and we can see this on autopsies, we can see sometimes on scans, but what we see in normal practice, the way that we diagnose this brain disease, just like any other brain disease, is sort of a checklist in what you look like and your behaviors, okay? And those behaviors look like a person has lost control of their drug use and then lost control of their life because they've lost control of their drug use. That's the disease of addiction. It's a chronic brain disease, okay? Chronic disease, brain disease. So that means brain means stigma, right? Chronic disease means we know how to handle this with physicians and a biological, psychological, and social approach to treatment. So if you are starting a sentence and you want to talk about, say, opioid addiction, and find that sentence, if you took the term opioid addiction out and put in the term diabetes, doesn't make sense even, then you probably have something wrong with your sentence and how you're conceptualizing this disease. You don't go away for any amount of time and come back cured from your diabetes. You do not recover from your diabetes. Recovery is the process by which a person engages in living their best lives. It's how they actively manage themselves a moment at a time, a day at a time. Remission is what we doctors try to do, which means you're not showing any signs and symptoms of your disease state. That's remission. That's not recovery, okay? 2 different concepts. Am I making sense so far? Thank you. I like to make sense. It's one of my many weird little quirks. So if you think about this in the workplace, and I will show you what is available for you downstairs. If you haven't picked up a copy, please do. I live in Louisville, Kentucky. Our Healthcare Collaborative put together this toolkit. And the things that I really love about this toolkit is it talks with the correct language, as I was just doing. It talks about the issues in the workplace around opioids, which are not simply tell your employees that opioids are dangerous and they shouldn't take more than they have to, but it talks about things like using data analytics, about how to do your benefit design to increase access to appropriate care and decrease access to care that can be harmful. I mean, we know that sending people off to, a 28-day rehab, if they leave and they're not on medication for opioid addiction, they're more likely to die within 6 months than if they had not completed that rehab, right? You don't want to be paying for care that is not helpful or even harmful. It talks about policies to transform culture, and boy, culture is something that happens at Johnson & Johnson. We're going to talk about this in just a minute. And it also talks about legal considerations, so the same kinds of ways, we're talking about parity, of course, that you would deal with a person who now is having an increased problem and needs to increase their physical therapy and their time off work for physical therapy. Addiction is not something where you go away, you come back fixed. This is a chronic disease state. Things wax and wane. Things flare up and calm down. So people might go from an outpatient level of care, which is a specific level of care, you can learn about this in the guideline, to maybe intensive outpatient, 3 days a week, 3 hours during those days, and et cetera. And so how to align your benefits in parity with your physical benefits. So just a very brief overview, but I wanted to set the stage that would also be helpful for our discussions as we go forward. Okay, so Geralyn, Johnson & Johnson, certainly. Been a leader in providing the kind of open culture and supportive culture that's so necessary for your employee base who are dealing with their mental health and substance use disorders, not only with themselves, but among their families as well. So could you talk about that a bit?
Sure, and I'll talk about the program that we developed at J&J.
The ambassador program.
So,
thank you.
So I'll start by saying I live with depression and an eating disorder, and I would have never said those words a couple of years ago, especially in a public forum like this. But it started for me really a couple of years ago. Everything came to a head when I was going through a very difficult divorce at home personally, and at work, things were just really everything was becoming very overwhelming. And I never knew that I had a mental illness. It was something that I didn't want to face into. And I got to the point where I wanted to take my own life. And it was at that moment that I knew I needed to get help and treatment. And back then, this was about 3 years ago, I was an HR director. So I'm in a role at Johnson & Johnson coaching people, sending them to the employee assistance program. And here I am, can't help myself. So I did reach out to the employee assistance program, which is a great service that we offer at J&J. And I got finally, after many, many years, got the help that I needed, but it's still a journey. I'm still in treatment. And when I went through that year, the following year, I saw a TED Talk by Craig Kramer. Craig is our mental health ambassador at Johnson & Johnson. It was a position, actually, that he created. And he talked about his daughter and how she had an eating disorder and how it impacted his whole family. And it was just hit me so close to home that I just knew I had to connect with him after he spoke. And so I connected with him and I shared my story with Craig and I said, we have to start an employee resource group. We have to. I felt like this is my purpose. I finally figured it out after so many years. This is what I'm meant to be doing, and I don't want employees to feel the way that I did, very isolated and alone, and that I would never advance my career again, if I were to come out and talk about that I have depression. So I started to talk about it, and I thought, if I don't start to talk about it, then how am I going to set an example here in the company? So after talking about it, it took about a good 9 months to get the employee resource group up and running. We are a part of the Alliance for Diverse Abilities employee resource group, so we're the largest part of that. We have mental health, disabilities, and autism spectrum. And we launched in April of 2017 with a little under 100 people. And then over the past couple of years, we now have over 1,000 in 30 countries around the world at J&J. So it's been, one of the things that have been so surprising to me is just the amount of passion, and people want to talk about it. So if people start to hear other stories, then they want to be able to share their story too. So the program we developed is called the Mental Health Diplomats at Johnson & Johnson. And we're a very passionate group of employees around the world, very diverse group. And our mission is we want to change the world's mind about mental health, for sure. And there are a couple of things that we really have been focused on in the past couple of years. First, really scaling our employee resource group. We grew pretty phenomenally over the past couple of years, and we had to put the infrastructure and support systems in place so we can grow. We also provided mental health awareness training, first aid training in that first year for our mental health diplomats. So if you wanted to become a member, we wanted to make sure that we gave you the skills and knowledge in order to be a good mental health diplomat, understanding what your role is and what your role is not. So for example, their role is to not be a therapist or to diagnose. This was something that was really important that we had to ensure through legal and other compliance areas that that we needed to educate our members that they were not there to diagnose, but to recognize that employees might be suffering. We teach them, here are the signs and then symptoms that you can look out for in the workplace. So we've trained them, and in this year, or 2018, since we were growing so rapidly, we needed a different training solution. So we have a virtual training program that we roll out to our diplomats that's virtual. It's a 3-hour course. We designed it with our partner, external partner, and we offer it at least once a month. So that was the first thing that we really wanted to focus on in addition to scaling ourselves up. So the second thing I want to talk about is creating awareness in the company. And that is something that we definitely focused on, and I'll give you an example. World Mental Health Day is on October 10th. So that first year that we started this group, we had about 25 sites within J&J who were represented. And we provided a toolkit. They could do whatever they wanted at their particular site. And it was mainly in the United States where we had people who were participating in this event. So last year we had our mental health diplomats, since we have grown a tremendous amount, we had over 80 sites around the world in 32 countries. So we've really expanded our reach globally in order to touch people and to really educate our employees around mental health and creating that awareness, which is so important, and to really just eradicate that stigma that exists. It is so heavy in the culture. I do think that we've been able to make some progress in this area. Once you start talking about it and make it less awkward for people to talk, then more people want to engage in the conversation. So that's been a pretty big focus for us.
Thank you. It's so important to be addressing these issues directly with the employee base because the amount of shame, the amount of guilt that they are owning for themselves and for their family, just normalizing and putting this out there really helps them to be their best at work, which is what every employer wants. So thank you for sharing that through David. Best Buddies, what a phenomenal approach. Clearly a leading, new way to be approaching being supportive in the workplace, and a very different approach than what we've talked about so far. So could you please enlighten us all a bit about your program?
Sure, thank you so much. So Best Buddies is a global volunteer movement that we like to say is changing the world with the power of friendship and the opportunity of a job. And we are working worldwide to help individuals with intellectual and developmental disabilities, so individuals with like Down syndrome, autism, and other varying exceptionalities, to find meaningful employment and work with them directly on finding out what their specific dreams and hopes are and what abilities they have to be able to contribute to an employer space. And we have friendship programs that are around the world. And the reason why I bring up the friendship programs first is just that the number one reason why a person with an intellectual or developmental disability is not successful in an employment space is due to a lack of social skills. So if we're able to help match individuals with their typical peers in a school or at a college or in an elementary school and be able to talk to them about what it means to be a friend, how do you develop skills to be a good friend? What makes a bad friend versus a good friend? And having these conversations and really helping people to connect with one another is so important. And those are the same skills that these individuals are going to need to be able to go into the marketplace and have a great job. And Best Buddies supports individuals with intellectual disabilities in specific jobs for the life cycle of employment, which is a model that is not always, I don't think there's anyone else that is doing that, where we're staying with both the employer and the person in hopes that, what if they decide to promote an individual with a disability to do some more additional skills or to transfer to another job? Or what if there's a change in supervisor, and maybe that supervisor has never worked with someone on the spectrum or doesn't know how to handle a particular scenario with a person with a disability. And so Best Buddies is there, full force, being able to provide those specific services to both the employer and the person with an intellectual disability. And what's really been a game changer for Best Buddies specifically is that we were able to partner with the Institute for Corporate Productivity, which is a company that works with human resource research analytics. And they were able to go and survey the top Fortune 500 companies about how they are hiring people with intellectual disabilities and what their success, what was their approach, was it super hard, was it harder than they thought? And they came back and identified these 4 amazing business benefits of hiring individuals into the marketplace, which then changed our conversation when we were approaching people in HR about wanting to hire from our pipeline of people. We know that we can change the culture of a company, and we know that we can enhance the business benefits in the company. So we hired somebody at Central Park Conservatory in New York City, and their main job is to greet people over at the castle. He's on the autism spectrum, knows so much history about the conservatory and the castle, and he would direct people and give directions and things like that. But one of his primary jobs was to ask people for a donation on their way out. Within the first 6 months, he increased donations to the Central Park Conservatory by 119%. And in 1 year to 146%. And over the last 3 years has been able to maintain that. So we know with the proper supports, support from C-level positions all the way down to the supervisor positions, that we can help bring success and have a really great opportunity for someone with a disability to be successful in the marketplace.
Thank you. So, Terrence, the Ohio Bureau of Workers' Comp, clearly taking an innovative approach to supporting a workplace. So could you tell us in a few words, well, I guess maybe a little more than a few words, what it is that you're doing?
Kelly. No, thank you. And I have to say first, I already shared with this group, it's really humbling to sit with people like these folks and yourselves that have taken a proactive stance on this. One thing I've learned, I practiced medicine for about 25 years in Southern Ohio, which some people call the epicenter of the opioid epidemic. In Ohio, we like to say we're number 1 when it comes to football, right? But to be number 1 in mortality for several years straight for opioid deaths is not something to be proud of. And one thing I learned in Portsmouth, Ohio, is that when bad things like this happen, good people rise up and do great things. So thank you all for your involvement with that. And as I reflect on this, because we know so much more about treatment of this brain disease now, right? So things like mindfulness and meditation, CBT, we know that the brain can be retrained, and that's important. But it's also for those of us that are, in government, in medicine, in the corporate world, to kind of, get on the other side of our brain sometimes and not worry as much about the numbers and start doing some stuff. And the only thing that gets me there is, as I reflected on this morning, is my personal experiences, having people in the family die, having people in the family witness things that as children that they shouldn't have to witness. Those are things we all have the ability as leaders to address. And thankfully, in our state, we've had now 2 governors. Our most recent governor is very supportive of mental and behavioral health and substance use disorder and treatment, prevention, and recovery. So he's nudged our agency, the Bureau of Workers' Compensation. We're a little bit different because we're one of the few state-funded workers' compensation systems. For those of you that know about workers' compensation, if in Ohio, if you're not big and self-insured, you're insured by the state. So we have about 240,000 employers companies that we insure. So it's a big deal. We also are the regulatory agency for workers' compensation. So in the medical division, we can do things like take drugs off of our drug authorization list. We can do things like insist that doctors integrate mental and behavioral health into the treatment of musculoskeletal injuries. So we have that leverage, and the governor said, well, let me see you do more then. And he came up with this thought that, there are people in recovery that need to be reconnected with employment. As a state insurer, can you help those folks? So this name might be even longer than your title. It's the Substance Use Recovery Workplace Safety Program. So as an insurance company, by statute, people pay us premiums, and we pay out claims for medical benefits and also compensation. Well, we also can use that money for safety. And this is a big question. Is it safer? We have employers that are, talk about stigma, we have employers that are still telling us, we don't want to do drug testing because we're afraid, we can't find enough employees, and we know we might lose, some numbers say 30 or 40% of our people. And so is that a safe situation? We say not, and so there are all these people that are in recovery, and our definition of recovery, I think, is very broad. We say, yeah, you used to use, and now you don't. You come in and sign a paper and say, I'm in recovery. Well, you're in the program, and the cost of hiring folks in recovery has been borne for the largest part by employers, and we said to employers that if you have a random drug testing or pre-employment testing, or if you have reasonable suspicion testing, we'll pay for that if this person's in recovery. So we kind of mitigate your risk. If somebody is intoxicated on the job, that won't count against your experience in the insurance world. We also, one of the big components is the training for management. And it used to be that, training for managers who manage people that may have a substance use problem was, what are the signs? Can you identify the signs? And then it's kind of like a gotcha type of thing. Well, we learned from our second chance employers that they have a welcome and open environment, and people don't hide things from their human resources people. They come in and say, hey, I screwed up last weekend, can you help me? And so the question about is this, is that a safer situation than not knowing? And we do know it's very much unreported in the workplace, substance use. So we think that we're offering the employers an incentive. And then finally, things like this, we're providing a venue to talk about this, because the more people talk about it, the more accepted it will be. And we just have some fantastic people in Ohio that are already doing this, and we want to support them in any way that we can. One last thing I'll mention is that we use local infrastructure. In Ohio, we have what we call ADAM-H boards. They're alcohol, drug addiction, mental health boards in each county, and we give the money to them to administrate the program locally, so they can connect with local treatment centers and make that connection to local employment. We're in our pilot phase. Just this past quarter, we just started dispensing money, and in 3 counties, we've already given away $250,000 for the program. Thank you.
Well, thank you for walking us through that. I think it always bears repeating that the myths about people, employees who are in recovery, are just myths, right? People who are in recovery actually have less absenteeism than the average employee population. People who are in recovery actually spend less money in health care than the general employee population. You just can't say these things enough times in order to get around that stigma. So I really appreciate your sharing some of that with us.
Thank you.
And again, on a very personal note here, Carol, you come at this really from lived experience in a way that's so valuable for us to hear about. And I'd really love for you to enlighten us a bit about some of your journey and some of the things you've learned that we should keep in mind as takeaways from this.
Okay, I was 40 years old. I was a college professor. I had a loving husband, 3 healthy children, a beautiful home, and money in the bank. And depression brought me to my knees and changed my life forever. Since that time, I've been hospitalized 4 times with over 100 days in psychiatric wards. And because I have something called medication-resistant depression, I have had over 50 shock treatment. And people are like, whoa, do we still do that? Yeah, we still do that, and it's probably more effective than, not probably, it is more effective sometimes than medicine. We have an 85% efficacy rate with ECT and only a 40 to 45% efficacy with medication. So yes, it is still being used. And so I am out there speaking about what recovery really is. One of the things that I had to recognize that because I was medication resistant, until they were able to raise me out of the suicidal ideation so that I could actually think a little bit and then go on medication, was that pills don't teach skills, people. They don't teach skills. And in order for you to be in recovery for a long period of time, you need skill sets. And what happened to me, I had 4 hospitalizations in a 10-year period, and I literally got sick of being sick. The doctors could only keep me well for sometimes 4 years, sometimes 2 years, and I didn't change anything. I did everything they told me to do. I remember saying, if you tell me to eat raw slugs every day and I won't get sick, I'll do that. And I wanted to get well, and the medical profession couldn't keep me well. So I went on a quest to find wellness. And I'm happy to say it's 19 years since I've been sick, which is... Now, I work on wellness 365 days a year, 7 days a week. It's not a destination. Wellness is not a destination. It is a journey. And I recognize, and there are some times when my psychiatrist will say, don't get arrogant because I've seen somebody get sick after 20 years. And I'm like, why would you tell me that? That's not a good thing to tell me or to plan in. And so I started speaking in medical schools and nursing schools. That's where I started. I wanted to get people before they got tainted by the system. And I wanted to say, you need to start talking about recovery from day one. Because when I was diagnosed, and it's been, 29 years now, 29 years ago, one of the things that I recognized is that they planted seeds of fear and limitation in me instead of hope and possibility. And so I needed to hear messages, positive messages, rather than all of the negative messages. Another thing that I noticed was in the healthcare system, I call it, there's 3 stigma. First one is self-stigma, and I stigmatized myself for 10 years. I didn't tell anybody in fear that the college wouldn't let me come back in fear that my neighbors wouldn't let their children come to my home. So I kept it a secret, and keeping a secret in itself is detrimental to your mental well-being. And so, and then there's healthcare stigma. And to some degree, I didn't think they ever thought I could get well, because they would say things like, oh, here comes a frequent flyer. And I'm like, wow, I wonder what they say about me when I'm not in earshot. And so there were times, and when I went to a medical school in Philadelphia within the last year, and I said, this is what recovery looks like, and a couple of medical students said to me, you mean you can recover? I wanted to cry. And I said, we're not always sick. We go back to work. We pay taxes just like you. And so changing that. And then we have the public stigma. And the public stigma, it's just that people, they just don't know what it's like. And it's not that they're arrogant, they're just ignorant. They don't know. When they say, I remember even my own parents, God rest their soul, where they would say, look at those pictures of your kids. Don't you want to get well? Don't you want to get well? Come on, pull yourself up. Don't you want to get well? I couldn't get well for myself, let alone for my children. And so the more I'm out there speaking and the more I go into different places and I tell my story, which was never an easy thing for me to do from the beginning, was not an easy thing. I used to shake for hours after I would tell my story. But since I've been doing it for 12 years, I only shake for a couple of minutes afterwards, which is not as bad. But So as my journey of telling my story, because I've been out for 12 years now telling my story, I now tell my story in HR places because my hottest topic right now is starting the dialogue, depression in the workplace. It's workplace's dirty little secret. Employers don't really want to hear about, and employees are afraid to tell you. They're afraid to tell you in fear that it's going to limit. And I have a son who struggles with depression, and I have an anxiety. I have a grandson who struggles with depression and anxiety. However, they've had a mother and a Grammy who got well. So when they're sick, they recognize they need help, no different than if they broke an arm. And so they get help. And my one son said, I don't use EAP, Mom. And I said, why? Because he said, I'm afraid that somebody's gonna find out that I've used it, and then it's gonna limit my ability for promotions. So I said, well, what are you doing? He says, I'm going to a psychologist and a psychiatrist, but I'm just paying cash. I don't even give them a check, Mom, because I don't want any paper trail. But see, so that's what we still need to get over. We need to get over that it's okay. When I heard today from the platform that only 3 to 5% of the EAP programs are getting utilized, it breaks my heart. Now, on another part of my life, I'm an international executive coach. I coach C-level executives. And because they Google my name and you see all the things I've done in the mental health field, they start talking to me about their mental wellness. And they tell me my wife, my child is in a hospital right now. Or I've had executives tell me that I deal with anxiety, Carol. I have something called the imposter syndrome. I'm so afraid they're going to recognize that I'm not as good as I am. And I'll say to them, well, I said, I'm a coach. I'm not a psychologist. I'm not a psychiatrist. I can't really unravel that because that's not my wheelhouse. But what I can do is to say to you, give yourself the gift of counseling. It's the best thing you could possibly give yourself to get things get them out. And I remember one executive saying, he was from Australia at the time, or he is from Australia, and I said, let's do a little Google search and let's see if I can find you an online anxiety disorder group, which we did. In about 20 minutes, he said, Carol, you have given me more hands-on information than both my psychiatrist and my psychologist in less than 20 minutes, and I've been going there for 2 years. So I think people need to hear, people that are living in recovery, that you can get to the other side. And when people come up to me and say, you made it, maybe I can make it. Yeah, you can make it if you do the right things for yourself. But it's like anything else, you've got to find out what works for you, because we're all different. But this bit of sharing the stories, that's what people need to hear, because the stories not only normalize it, but makes it accepted. Now, I don't know about anybody in here, but I could remember when I couldn't talk about cancer. Anybody else remember that from in the workplace? Or even AIDS. You couldn't talk about that. Well, now we can't talk. We've got to jump the hurdle to talk about mental health disorders. Because mental health disorders, they're a physical disorder of the brain, no different than a heart problem or a cancer problem. They're no different. And what happens in corporate America that really saddens me, because I hear it over and over again, is that mental health disorders become a performance issue. They can't meet their expectations or their goals because they can't concentrate. I couldn't concentrate. I couldn't make a decision. I was isolating. It was all of those things. And so then they get on an action plan, and what does the action plan do? Takes them to show them, no, I can't do it any better. And so then they fall down, and then what are they? They're terminated. Yet we know that 80% of people with depression and anxiety go back to work. Go back to work. And as you've already said, they do such a good job, even better than the employee without a problem.
Yeah, no, that's exactly right. The truth about the cost of healthcare costs, the truth about absenteeism, folks who are in recovery from addiction, better numbers than your average population of employee pool, and just so much myth that's out there. We are going to be taking questions in about 10 minutes, so I'll ask you to think about those at the moment. But I'd like to go around one more time and give everybody certainly no more than 2 minutes to talk about the things you would most like to impart. I know I asked you specifically about your programs and et cetera, but the kinds of things you would most like to impart on folks. And you didn't know I was going to tell you that, so I'll give you a minute to think about it while I give you my piece then. So my piece is that addiction is a chronic brain disease. And we have in this country a system that grew out entirely outside of the medical care delivery system, which means the level of training of the people that are in addiction treatment programs that are providing care, the kinds of levels of care and certifications are inconsistent. It's almost impossible for you to know if you're looking for a treatment program, whether a program even is capable of providing care at a specific level of care. Now, there are specific levels of care, and you can look at them and read about them in the document I told you about earlier. But it is going to take us a while to build that infrastructure. But employers are the purchasers of health care in this country. And you need to make sure that what you are purchasing and that your payer is paying for an adequate and appropriate network of providers who are providing evidence-based care. We know how to deal with diseases. We use a biological, psychological, and social approach. We individualize it based on structured best practices. Okay? So we don't just individualize care from the get-go. We start with what are best care practices. We need to be doing this for addiction the exact same way we do it, as mentioned, for any other disease set. And we're going to take a while to get there, but employers need to understand that you hold some levers to help us get there. So that would be my piece at the moment.
Okay, I would say mental health and talking about it is such an awkward conversation, especially in the workplace. And there are so many people that have their own stories, and they're suffering in silence. So we want to be able to, what I would say is, start the conversation, be brave, be courageous, be vulnerable, get people out of their comfort zone, because it's the only way to make change happen. So that's something that I'd like to say, as a leader within J&J, we have been very fully supported by our senior leaders. I think they understand the importance of mental health and starting that conversation within the workplace, but it's something that we have to absolutely keep working on. We'll get there.
Thank you.
So the unemployment rate for people with intellectual and development disabilities hovers around 81%. So my advice would be, this is a great pipeline of people to bring into your workforce. I have my little pamphlet I use. Inclusion is my happy place. I know inclusion works, and we have a great group of individuals that want to work, that want to make a meaningful paycheck, that want to contribute every single day. And if you're an employer or you're a person that helps make decisions in the hiring process or know people who do, Best Buddies would love to be able to help you diversify your workforce and provide opportunities for people with intellectual disabilities to be incredible resources and employees for your company. So hire. That's the biggest thing for me, hire.
That's a great message. Terrence?
Yeah, I'd like to echo a couple of things there, maybe in a different way. So we're talking about the workforce, and so we all need support in all areas of our life. Ask my wife, ask my boss. So let's focus on the workplace. We all need support, and there are all kinds of support. Well, we'll look at it a little bit differently. So people in recovery just need a different type of support. I mean, that's all it is. And so if you're at all moved by that and you're in a position to make decisions about this, just do it. I mean, you just got to do it, and you'll be very grateful that you did.
And I would encourage each of you to become a stigma buster. It doesn't matter where you are or what you do, that when you hear derogatory comments or you hear offhanded remarks, that you don't pass them along. or that you just call people's attention to how language can actually manifest itself. And to recognize that we all have a big hurdle. We all have a big hurdle. Every one of us, doesn't matter, in this room, and we all have a story. And when you get to, as they said this morning from the platform, when we start looking at people like people, you know, and just look at them, we're not human doings, we're human beings. So when we look at them as a human being, someone as a person that has feelings and a heart and passion, it's very different. It's very different. So become a stigma buster. And let's together, each day that we break down the stigma, one more step is a day closer we are to more and more people getting help. Because today, only 1/3 of people with treatable illnesses get help. 2/3 go untreated because of the stigma.
Thank you. A lot of passion on this platform. We're going to open up for some questions here. We've got a microphone here. Just in the interest of time, if you could do one question at a time, that would be great. And as somebody's coming up, let me, I was probably remiss in saying this, which you can pick up because some folks might be watching this on the web later. So this is the Kentuckiana Health Collaborative, Opioids in the Workplace, an employer toolkit for supporting prevention, treatment, and recovery. I live in Louisville. The greater Louisville area is Kentucky and a part of Indiana. So we are Kentuckiana. It's free, just download it. There's a link, we just want you to use it. We built it for our community, but if other communities can use it, please do. So, any questions?
When you ask a question, please introduce yourself and tell us who you're with, if you don't mind.
Good afternoon. I'm Travis Atkinson. I'm with TBD Solutions. We're a healthcare consulting group in Michigan. And thank you all for being here. My question actually is for Geralyn, and it's two questions. First of all, the mental health awareness training that you provided to your employees, was that mental health first aid, or was it something that was created by Johnson & Johnson? And then my other question is, were there any positive unintended consequences of providing this platform for your employees to talk about mental health and to receive this training?
Thank you. So yes, we started with mental health first aid training, which was developed we worked with WellSpan to deliver that training. But then when we wanted to customize it and get it down, because it was an 8-hour training program, and logistically it was a nightmare trying to train people around the world, and very expensive to do that. So they worked with us to customize then the 3-hour program, which has been really, really successful. And then to answer your question about what are the positive kind of unintended consequences, what I would say is that this group has been so passionate in the organization that it's empowered people to write books, to do bike rides for mental health, Move for Mental Health, to write blogs, to develop a Slack community, to help people deal with depression and anxiety or whatever it is that they might be going through. So it is amazing to see how engaged our employee base has become in wanting to make a difference in this world around mental health.
Other questions? You're going to leave all the other questions up to me?
I'm Stephen Walt. I'm the president of Veritas. We provide consulting for corporations on mental health and addiction. So I guess the question I would ask is, there's been a lot of talk at this conference about reducing stigma, getting employees to ask earlier on in the process for help. A little less talk about poor clinical outcomes, the very high rate of relapse, people getting prescribed an antidepressant and not refilling the prescriptions, and nobody really overseeing and coordinating care. So I may throw that out there. You know, are there any programs in place to help coach and coordinate care to improve outcomes?
So let me take a first shot at that. You know, what we find in terms of what we call adherence, as a physician, we work with a patient, hopefully together, to come up with a treatment plan. And adherence to antidepressants is not unlike adherence to medication treatment for addiction, which is not unlike adherence to the treatment plan for asthma and diabetes, which is antibiotics. This is a ubiquitous issue. This is not simply an issue of mental health issues. It is a ubiquitous issue of helping people understand their needs to manage their conditions and work with their care providers. Now, you mentioned care coordination, which can be very helpful in being able to outreach to people and help ensure, are you following that treatment plan? Is there a problem? And that is something that we're working on. This is we as a medical community, I would say, are working on. We do end up with some issues around payment for some of those kinds of issues. When we talk about relapse, so this is another word that's helpful, I think, to talk about. So think about addiction as a chronic brain disease. Okay, so think about diabetes. Okay, so let me just paint this up so we understand what relapse means. Okay, a person with diabetes, say, was not managing their condition. They weren't checking their sugars. They weren't watching what they eat. They weren't taking their insulin as they should be. And they keep coming in and out of the emergency room with very high sugars, okay, which is very dangerous. Okay? And they keep doing this. Now, at some point, they start to manage their disease state. They're watching their sugars. They're watching what they eat. They're watching how they exercise. And they're getting out of the emergency department and in the inpatient environment because it can be very dangerous when people have very high sugars. And then they go to a party and they eat some ice cream. And maybe they have a drink of alcohol. Okay? We do not say that that treatment plan has failed. We don't test an outcome by time to first cupcake. This doesn't make sense, right? A relapse is if they stop managing their disease state and they're functionally having problems and they're back in the emergency room and back in hospital. Okay, we do not expect perfect adherence for a patient to follow their treatment plan for any disease state except for addiction. This makes no sense, okay? There's lapse, that's what we call it as addiction doctors, and then there's relapse. Okay? But some of this really becomes a matter of education, understanding, and being there to provide a supportive environment for your employees so that they can reach out to their EAP, to their HR, to their healthcare providers, and get the kinds of supports they need to keep a lapse from becoming a relapse, or to keep a lapse from becoming, or to keep a relapse to becoming something that becomes incapacitating and fatal. Anyone else want to pick?
I completely agree with you. One of the things that we're doing at Johnson & Johnson is providing training for managers in order to exactly what you said in terms of creating that space, that environment where employees can be open and talk about what they're going through, or if they need to, go back out on short-term disability or whatever it might be. We bring people back, and sometimes we put them on through accommodations to transition back into the workforce. Certainly, when you're out on short-term disability, you're working with a case manager, so from an adherence standpoint, you have someone who's helping you, and through coming back on a part-time basis, let's say. But I love the idea of what you're saying about an adherence program or something really to support employees in the workplace. I think that's a great idea.
It's a great question, and it gets at some of the things that were talked about this morning, that sometimes the way that medical care is paid for in the United States is not conducive to integrated, multidisciplinary, value-based care. There are some folks that are trying to move that direction, and Medicare has come a ways with that. They haven't been able to pull it off. We talked to our major providers in Ohio about that, and they're trying to do it, but again, they need some type of a bundled system of payment to allow them to be able to do that. It's tough, and I've worked at small community hospitals too. So the drivers for medical care right now are orthopedics and cardiology. Those procedures are what drive the healthcare dollar, delivering babies and providing psychiatric care does not right now. So it's a fundamental problem.
That was so well put. The idea about the silos in our payment system is so important to understand how we get into these pickles that we get into. I was in a meeting and I heard somebody who should know better, a chief medical officer of a hospital system, say, you know, we've been able to keep our behavioral health spend equal for the past 3 years. And I thought, in the middle of an epidemic of overdose deaths, you think keeping your behavioral spend even is a good thing? Because we're not looking at your total cost here. Your total cost is your behavioral spend, yes, plus your medical spend, yes, plus your pharmacy spend, yes, plus your imaging spend, yes, plus what's happening to your turnover, what's happening to your absenteeism, your presenteeism, what's happening to your safety record. It's looking at exactly what you're talking about, having to look at the totality of this issue in the workplace rather than just looking at a silo that will allow you to be moving your companies forward. A very, very important point. Thank you. Sir.
Hi, my name is Gaurav Agarwal. I'm with the Northwestern Medicine and Director of Physician Wellness. And so as we look at physician burnout, we talk a lot about kind of the organizational factors. And so we've talked about benefit design, but workplace design also can play a major role in decreasing stress in the first place. Right? We shouldn't be giving benzos to help people deal with stress. We should decrease stress. And so to me, that's something very important. I was wondering, David, if you had any best practices in terms of how you work with employers to make sure that the design of the jobs for your clients is set up so that they can succeed.
Sure. So I like to tell people, I think culture eats profit every single day. So creating a culture where people feel, compelled to be able to share their challenges, and then also to be able to have conversations with their managers and their managers' managers, and have that open environment is really, really important. And I just think too, from a best practices for the participants that we're working through with Best Buddies, they have a number of individuals who, from their parents or their siblings or their guardians, about how many hours they can work, and what are their benefits going to be in jeopardy if they work too many hours. Like, these are real things that are happening for people with intellectual disabilities, and being able to help support them and look at their paychecks and look at the benefits and explain what Social Security is going to look like and what their medical is going to look like through their company is really important. So I would say the best practice from Best Buddies' perspective is that we are a resource to both the employer and the employee every single step of the way to handle the logistics of really human resources. And I think you said it so good about human beings. Like, it's hard to hire any human, and we wouldn't have human resources if it wasn't hard, right? So we all have challenges. That's why human resources is there. And I think too, to just make sure that people understand, like, we're here to help you do your very best and contribute in a meaningful way.
It's all right. My name's Gary Cohen. I'm with Employee Resource Systems. We're an EAP. Excuse me. One of my questions, though, is, as an EAP, we advocate for people to get help, to get well. But there's two things that resonated for me during all of your comments. One is that we still have to deal with the Americans with Disabilities Act, and you can't have disparate treatment in the work setting. So how do you deal with, if I know that Jane or John Doe employee has mental health concerns, or has an eating disorder, or has cancer, or whatever, legally I can't treat that person differently in terms of the performance expectations of how they're supposed to do their job. I can try to cut them slack, if they need to go to medical appointments or psychiatric appointments, whatever, but there's this, we're walking on a little bit of a tightrope in terms of disparate treatment. And I think, I'd be curious to see if anybody has any comments or thoughts about, there's the ADA implications and just the whole issue of disparate treatment. And we do live in a litigious culture where you treated me badly, I'm going to sue you, employer. So just some thought.
So as a psychiatrist, certainly I've been involved with lots of folks who need reasonable accommodations. And there are reasonable accommodations which can be made to help navigate some of the medical legal issues. So that's sort of the bucket, I think, that a number of things go into here. Just anyone else like to make comment?
No, I love this question because it is one of the things I'm so passionate about with managers, and the reason why we have to train them and give them the skills and the knowledge to manage their employees, to recognize when an employee is struggling with something. They have to have the conversation with them. Are you okay? We have an employee assistance program, to give them the resources that they need in order to get well and having to avoid going out on short-term disability. Let's prevent it. So when managers aren't educated, so they put people on performance improvement plans, just like you were saying. So there has to be a way to teach managers that there's only so much you can do. You can give that employee who's suffering the resources, the guidance. Maybe they do have to go out on short-term disability. But then if they don't get the treatment, if they don't get the help, that's their choice. And as a manager, you really need to manage their performance. So that's what it's about. And it's a hard line. You have to balance. But I think if we can educate our managers on how to have the conversation and really recognize when someone's struggling versus someone's a performance issue, that's something that we have to just get better at.
Yes.
So, take the mic, please. Thanks. So your question makes me think of when we were using the ADA to make buildings more accessible, we moved away from accessibility to universal design. And we created communities where we used principles of universal design that were initially, allowing for wheelchairs to get to the beach, and so you put these paths. But what happens is everybody's able to access and use these principles of universal design. The same principles apply and can apply to schools and universities. And what we're trying to, I think, to message here and throughout the day is that you're not doing this as a separate program for one group of people, but you're actually creating a culture in your workplace really on the principles of universal design. The more that you as an employer and as a workplace create a safe culture for anybody, not just the people with mental illness or not just the people who have a visual impairment or whatever. So I think it's a really great question, but I also think it's kind of a mindset and a culture of what we're trying to say. So the base is in the bottom. I always used to say when I was in my disability world, ADA is here, universal design is here, and then inclusion for all is really what we're striving for everyone. So thank you.
Thank you. And I would like to thank the Kennedy Forum here. We are just now out of time. For putting together this forum with some very different approaches, which I think makes things much more rich in the discussion. And thank you for taking your time to be part of this today.